Hi, folks. We are back with another WCC Wednesday, coming at you from video taping because I can't figure out how to make Facebook work with Zoom. So I'm Dan Schultz, the Community Health Program Director, and I want to tell folks a little story before we really get rolling here. Many years ago, I was born in a hospital in St. Louis called Deaconess Hospital, which is now part of the SSM conglomerate. And we had, in my tradition, the United Church of Christ, we had a tradition of deaconesses who were women, essentially Protestant nuns, who often did not marry and served in classrooms or in hospitals. So there is a long-standing tradition of nursing being involved with religious faith, going all the way back to the foundation of Christianity and probably before. Now, the hospital where I was born was also across the street from the monkey house at the St. Louis Zoo. But that does not reflect on the quality of nursing in the Christian tradition. That's my own thing. So I say all of this because we're joined today by Peggy Weber, who is, I believe, an RN, and is an experienced parish nurse and informal leader of a group of parish nurses throughout Wisconsin. And she's here to talk to us about parish nursing, what it is and what it does. So, Peggy, welcome.
Thank you. Thank you for having me. You talked about your beginning. I should just say that I'm half Catholic and half Lutheran. My mother was Roman Catholic and my father was German Lutheran. So I speak from both sides. So just
that's right. You had a mixed marriage, as they called it in those days. Yes.
Oh yes. Oh yes. Yes. Yeah. Yeah.
So tell us a little about the history of parish nursing.
Well, sure. Well, parish nursing it's incredible. It's incredible. I was lucky enough to be a parish nurse for about 20 some years. And I loved it. And parish nursing is nursing in a faith community. So it's a registered nurse who's taken a special course that because parish nursing is a specialty, much like pediatrics or infant intensive care, surgical nursing, medical nursing, peds, whatever. Parish nursing is a specialty. And so you go to get that specialty training. And I was able to do that back in 1997. Actually, parish nursing started probably in the 1980s. And it started by, you'll love this, a Lutheran pastor, Pastor Granger Westberg. And he was a Lutheran minister and a hospital chaplain. And he got really frustrated because he would see them so sick in the hospital or so sick in their home, and they went either home or to the hospital, and there wasn't someone taking care of them. There wasn't the follow-up. And he said, why couldn't we have nurses working in the church to help with the congregation, to help people with the congregation, either when they're sick or when they're in the hospital coming home, for follow-up care. So the parish nursing, started by a fabulous pastor who really, Granger just worked with parish nursing for years and years and brought it up to the high standard that it is, to the point that the ANA considers it a specialty. And the courses are offered, throughout the United States. They were very, very big in the 90s, started in the 80s, in the 90s and the 2000s, they were very, very big. In Wisconsin, Marquette took a lead on the parish nursing course, Concordia, Viterbo, Edgewood College. And now the Wisconsin Nurses Association has pretty much taken over facilitating the course. The course is intensive, but it's very good. Well, today we don't have as many parish nurses as what we used to have. back in the 90s, Milwaukee had over 50 parish nurses in Milwaukee. Madison had probably over 20, I'm sure. And then we probably had 50 throughout the state of Wisconsin. And these nurses would leave their hospitals and work for the church, in the church, taking care of the parishioners. But, you know, they were paid either by the congregation or they worked for a hospital system. And the hospital system would partner with the congregation and pay, you know, the nurse's salary. And the hospitals need to do nonprofit work, you know, to stay with Joint Commission and community outreach, etc. So that's why they did it. But today, there are very few paid parish nurses in the state of Wisconsin that are supported by hospitals. Some congregations are paying parish nurses, but the majority of us are volunteering. And, you know, being Nurses Week, I just, you know, once a nurse, always a nurse. And we're trained to continually assess. You know, you go to church and you look and you say, oh, I wonder how his diabetes is doing, or I wonder how her blood pressure is doing, or, you know, how is he recovering? You know, you just don't take that nursing camp off, even though you're 75 years old.
Sure.
We continue to do it.
So a good deal of what we have to talk about isn't necessarily parish nursing, but nursing in parishes.
And congregations, correct.
And congregations, right.
Yeah. I mean, there's so many nurses that are retired today that have this skill set and have this knowledge that could be used, you know, within the congregation. And yes, volunteer. I mean, when you think about it, I mean, you know, they can visit the sick. They can, you know, visit the people in the nursing homes, in the hospitals. They can have small groups, coffees for the widows. You know, they can do the blood pressure checks, huge blood pressure checks after the services. Not before they have the coffee. I mean, before they have the coffee, not after the coffee.
After, yeah, right. I know one parish nurse who told me that she could very lovingly yell at people to take their blood pressure medication.
Yeah,
right.
They love it. People love to be touched. People love to be touched, and they need to be touched. And you know that blood pressure is your first way in. It's your first way in, and you know they call it, you know, high blood pressure the silent killer, because we don't have signs and symptoms. We don't know that our blood pressure's up. And so that was always a huge thing. You know, you do it, you know, after church, like I say, before the coffee, the caffeine, you know, do the blood pressures. We do a lot of visits, groups, you know, bring in health professional people, go with doctors, go to doctor visits. That's a huge thing that we do, because when you're getting bad news, you don't want to hear it. And they talk in a language and verbiage that you're not used to. So it's an advocate. I mean, nurses can be advocates for people. Their assessment skills could be used many different ways, but they have to be invited. You know, nurses, nurses, I want to say need to be needed, but that sounds a little psychologically sick. But, you know, just to be asked, you know, nurses can do it. And one nurse knows more than another nurse. I mean, you know, they can do it in groups, and there's so many of us that are willing and able to help in congregations.
Sure. You can be educators.
Oh, absolutely. You know, there's many educational programs, you know, using Red Cross, using American Heart, you know, wellness, all different wellness groups. You know, there's information that we can bring speakers in. You know, nurses just know how to do that. And we know, not to brag, but nurses, you know, is one of the most trusted professions that there is. I mean, we hear many stories. And as you know, as a chaplain, as a pastor, people need to be heard and their pain needs to be witnessed. And so to be able to sit with people, to visit, you know, not to repeat it, not to put it in the bulletin, you know, not to use it in the homily for you next week. You know, it's personal. It's very personal. And I look back at some of the stories, situations, it was the work of God that we kind of were connected.
Yeah. Right. I and I'm sure many of the people listening have had this experience where as a pastor, people are sort of reluctant to talk about their health problems. Some people just sort of assume that the pastor doesn't understand this stuff, or it's not the pastor's business to be talking about this. And particularly with older adults, they feel like they have to remain positive all the time.
Yeah.
And so, I don't want to talk about this thing that is killing me, because then I wouldn't be showing faith, right? And that's in fact not the case.
No, it's not. And I worked in the two parishes that I think I worked for 5 different, I happen to be in a Catholic parishes, 5 different priests, and they were as different as night and day. But I always told them, you're the doctor, I'm the nurse. And so it's that kind of a relationship. And, I would always ask my parishioners, is it okay if I tell Father what we talked about? And never did I have a no, you can't tell them, but they can't tell it. You know what I mean?
Right.
It's too much. And especially situations where there's abuse or neglect, some of the distressful things, that are very hard to talk about,
Sure.
Especially abuse, neglect, those things need to be dealt with, helped with. And it's just easier if they can talk to a nurse, and then the nurse, uses that information as she needs to, with their permission, to inform the pastor.
Yeah, and not even abuse or neglect, but simple things like dementia.
Oh, yeah.
I have this diagnosis of dementia, and if I tell the pastor is going to make me do something about it. And I'm not ready for that. So we'll just, keep that under our hat. Right.
Right. Yeah. We do. They tell us everything. It's just like it's written on our forehead. Tell me how you are. Even in the grocery store, you get the bowel report. You're going through Piggly Wiggly. Laxative work, and you're going, oh no. You just common sense. It's just nice. It's just be yourself. Be yourself. Yeah.
Well, folks, I'm talking with Peggy Weber, who's a parish nurse and continues to be into retirement. And as you can tell, she's kind of a hoot to talk to. So always one of my favorite conversation partners. Peggy, how is it that you see God at work through the ministry of parish nursing, or how might people in those parishes or congregations see God at work?
Yeah, I believe that God works through me and with me, and just to reach out to other people. It's not me, it's God working in me. We have a little slogan, and it's, some of you might we take it. This is what we say: we suit up and show up, and God does the rest. We suit up and show up, and God does the rest. And we simply say that because we don't know what we're walking into lots of times. And, we can't be nervous about it. I mean, we're focused, but we can't worry about what's going to happen, because we know and we believe that God is with us. And all these serendipity things that happen, or just, how did that happen? Why did I see this person first thing in the morning? All of these things, God makes them happen. And, what am I going to say? What am I going to do? It's like the Holy Spirit puts the words with us. And, we do a little reflection maybe before we go into the house. I always did. I still do, Lord, be with me, help me, and when I leave, I say, thank you. I say, thank you for being with me, because we're not doing this alone. Anybody that thinks they're doing it alone, this is God's work. This is God's work. And, we're blessed with the Spirit. We're blessed with the energy to be able to do it. And just the presence, just to be with these people is pure gift. And, to follow that up in parish nursing, we always used to do theological reflections. You probably did that in the seminary, or you maybe still do it, but we had to do them once a month. And we would have to look at the situation, and then how was God with us? How did God provide? And then we would present that to the other parish nurses, and then we discuss it, and we'd say, oh yeah, so it was kind of that spiritual refueling as we needed it. And we can only do what we have the power to do. We can't do everything, but God provides, and we totally believe that. And you know, our work is never done. That was a hard thing, to have boundaries in parish nursing, because you always wanted
Sure.
to see one more person, and, you know, your family's at home, and, you know, but it's like a pastor's work, you know, we're never done.
It is. It is. I forget who it was that said there's really only three kinds of prayers, and that's please, thank you, and I love you.
Oh, yeah.
And I think that works for your kind of ministry.
Yeah, it does. And I just think the parish nurse, I should say one other thing is that, you know, we always treat with the triangle, you know, and the triangle, the Trinity, you know, and it's the physical, the emotional, and the spiritual piece. You know, so in parish nursing, we're not just taking care of the physical piece like you might be in a clinic or a hospital, but we also address the emotional and then the spiritual piece. So what's the purpose and meaning, the spiritual, what's the purpose and meaning of me having this illness, this situation? You know, what am I to learn by this? You know, what is the gift in this? So it's a very holistic type of nursing. It's the whole person, the whole family, the whole congregation. So you're treating the whole all the time.
Wonderful. Well, if our viewers would like to find out more about parish nursing and nursing in parishes, Peggy has said that you can get in touch with me, and I will put you in touch with her, and we'll get that conversation rolling.
Right, and the Wisconsin Nurses Association are doing a nursing course, parish nursing course right now in Fort Atkinson. So, you know, in Jefferson County, we've got a group I'm teaching next week in it. I think there's about almost 20 nurses. And we haven't had a class this size in quite some time, but they were able to get a grant through Fort Atkinson Hospital and Rainbow Hospice. So, so that these nurses, and they're pretty much Jefferson County. Maybe it's, I'm pretty sure I know that's the county. So it's available. Wisconsin Nurses Association is really heading up a big hunk of parish nursing, and Concordia has a course right now for the summer planned for the parish nursing course. And I don't believe Vertebral is at this point, but I can't speak about that for sure.
Sure. Well, I believe it is Parish Nurse Appreciation or Nurses Appreciation Week.
Oh yeah. Yep.
So let's end by saying, nurses, we appreciate you and all of your work, especially with our churches. And Peggy Weber, we really appreciate you being here with us today.
Thank you. It's an honor. It's always fun to talk.
Yep. All right, folks, we'll see you next week on WCC Wednesday.